I first learned about InterCommunity through being homeless. I was very reluctant at first to start something new. Once I got started, I loved it.
InterCommunity gave me the courage. They didn't tell me what to do. They have you realize yourself, what you're doing to yourself, because you have to be well for yourself, because if you're not, you can't do anything else.
I was absolutely desperate before. I was not getting out of bed. I was hardly eating.
I had a drug addiction. I went to 3 different homeless shelters. I never thought that that would be me.
When I first came for the admission evaluation, I just was really impressed and felt I felt a little more hopeful about things.
We are a community behavioral health organization. We've been around for almost 35 years. We're located in East Hartford. We're very close to all of the local and major highways. We have extended hours. We're open from early in the morning till later in the evenings and on weekends. And we have open access, which means whether you have insurance or don't have health insurance, we will be able to do the assessment over the phone, a quick assessment, and get you set up and get you into the right programs that you need.
I had a therapist at InterCommunity, and she made me see that I was in an environmental abusive relationship. When things got too bad, I just couldn't take it anymore. I was having the breakdowns.
The Seek and Safety group has helped me tremendously. It helped me deal with the post-traumatic stress disorder. It gave me some acceptance, some clarity as to what was wrong with me and how I can work to get better. I've been going like faithfully. I don't miss appointments. I don't miss my, I have a nurse that comes to my home.
Our staff are mobile. They go out into the community. They visit people in their homes, in their apartments, and really help them to gain skills to navigate very complex systems of federal and state governments. And they help people with everything from housing to food to medication to legal issues to primary care issues, health issues.
I'm able to be in public. I'm able to pay my bills. I'm able to just, speak up for myself, advocate for myself, advocate for my son.
We also have housing supported and supervised where people live in their own apartments, again, where most people want to live. They want to live in their own homes.
Currently, I'm in transitional housing, and I just got approved for permanent housing, like last week. So I'm really excited about the move. All that is through InterCommunity. Without that, none of this would have been possible.
InterCommunity is also JACO and CARF accredited. We're accredited in our outpatient adult and children's clinic.
I wanted to do a little exercise. We wanted to talk about feelings. I see children from the ages of 3 all the way up to the ages of 18. But many times we find that many of the functions or dysfunction that are going on in the child's life also is kind of a reflection of what might be going on in the home. We have many situations where children are separated from their mothers and fathers. And so I make that a personal goal to get dads to engage, and we've been pretty successful. Another service that we provide here at the Children's Clinic is teaching parenting skills. Many of our parents come in, they're young, single parents, and they haven't really had a history of strong parenting in their own lives. So we offer classes here in InterCommunity.
We also have crisis services. We were able to go into the community if we're called by any community members or family members or providers in the community. If they think someone's struggling in their home or somewhere out in the service area, we're able to send a mobile crisis team, people who are licensed clinical social workers, and they're able to do an assessment and hopefully talk somebody down or be able to go with them and bring them into whatever services they might need in addition.
For me, this is the best place to come if you need help, is InterCommunity. I enjoy coming here. I get my medications here. And the best thing of all is being in the social club Common Ground.
Another program that we're extremely proud of at InterCommunity is our psychosocial rehab club, which is called Common Ground. And that's a place for people to come in and hang out, but really to start assessing where it is they want to go with their lives, what are the skills that they need to do and accomplish their goals and objectives. I've been around where I've seen within weeks or months or whatever the time period is, and it's okay if it's years, but really have seen people turn around. I don't know if it's the excitement in the air, watching other people here who talk about how they came in feeling the same way in the same position and have really been uplifted and have gained the skills and the resources and just the motivation to really do what they've wanted to do with their life. And That is the greatest thing I think that we do here, the greatest gift that we can give and the greatest gift that we receive back from the people that we serve.
But I'll tell you, I've seen a lot of people come in here and get well.
InterCommunity's helped me learn how to deal with depression, anxiety. I tutor here 3 times a week. I did it for a couple reasons. One was I really wanted to give back something here. 2, it's often rewarding because you help people, and for some people it's helping set up email accounts, or even with job searching, or sometimes even a little bit with resumes, although if they're doing resume stuff, I always recommend the employment opportunities services here, because those people are great.
Carlos, how are you?
We very much believe in work. We know that the people that we serve can and have worked and want to get back to work. And so we have lots of skill building programs and resume writing and all kinds of things that our staff work with clients on to get back to meaningful employment.
It was through InterCommunity that it was suggested to me that I participate in a legislative training program advocating for people with disabilities. And I completed the program. I got a certificate. I feel that advocating for other people with disabilities or in recovery is very important to me because I myself have a disability. I myself is in recovery. I have a child who also has a disability. So this is going to be a long, hard road, but the rewards are going to be fantastic.